Before I say anything, I do want to express my apologies to my teammates, the class, Dr. Burke and Dr. Cunningham for my absence. I am currently in Texas resolving a family emergency issue. In terms of the presentation, one of the major aspects of community characterization is interviewing and identifying stakeholders. I had the privilege and good fortune of interviewing Dr. Raymond Cox, the current chief of OBGYN at St. Agnes Hospital in Baltimore, Maryland, and former chief of OBGYN in Prince George's County. The interview with Dr. Cox gave me a better understanding for how maternity and obstetric services were delivered in Prince George's County. It included knowing about the major players involved, the types of services being delivered, the funding for these services, some of the obstacles that they currently encounter while delivering these services, and some of the locations where these services were being offered. As you can see on the screen, the first question I asked Dr. Cox was, how did Prince George County provide maternity and obstetric services to the underserved populations, and who are the thought leaders? In his response, he said that the thought leaders were composed of 5 different people, starting with Dr. Donald Schell, the County Health Director, then Dr. Antoine Fumat, the Director of Neonatology at Prince George County Hospital, Dr. Ernest Badamo, the Director of OBGYN at Prince George County Hospital, Ms. Toby Obiger, the Director of Midwifery Program at Prince George County Hospital, and Jennifer Fahy, a midwife at the University of Maryland. He subsequently told me that private practitioners and an employee physician midwife club provide the prenatal and the deliveries. He further added that the employee physician midwife club also saw patients who did not have a physician assigned to them, and also saw patients from the county health department, performing 1,700 deliveries a year between both of these parties. Some of the places where these services are being provided for are private physician offices, the county health department, and the Prince George Hospital Clinic. He told me that some of the barriers that impeded or made it difficult to deliver these services was communication. And this is because the majority of the people being treated for are limited English proficiency patients, making it hard for them to deliver care effectively and communicate as well. Also, the patients that came had different belief systems and came from a different culture, something that staff had a hard time grasping. Although Dr. Cox did not mention any specific model of health behavior that was used, he told me that the way he did address the issue was by hiring providers who spoke Spanish or multiple languages, and hired staff who understood their culture. And lastly, the last important question that I asked Dr. Cox was, how were these services funded for? Although he did not specify the percentages, he stated that the majority of the funding came from the county and the state. With this being said, I do conclude the part of my presentation. Thank you.